As Election Day nears, much attention has gone to high-profile Senate and congressional races. But across the country, voters are also weighing in on ballot measures that can bring big changes to their states. As NewsHour reported from Idaho last week, one of the hot-button issues for voters is health care and whether or not to expand Medicaid, the joint federal and state health care program for low-income Americans. The state of Nebraska is another of just a few red states with Medicaid expansion on the ballot. And soon, voters in the Cornhusker state will see if they can do what their elected officials have been unable to.
Okay. Hi, Spencer. My name is Mary. I'm calling on behalf of Ensure the Good Life.
At a makeshift campaign office in Omaha, about a dozen volunteers are making calls in support of Initiative 427, a ballot measure to expand Medicaid in Nebraska. The group, Ensure the Good Life, is behind the expansion effort that would provide health insurance to an estimated 90,000 uninsured Nebraskans, those who make too little to get federal subsidies under the Obama-era Affordable Care Act, or ACA.
We're very excited about the initiative and what it can do to help those people that are caught in the coverage gap.
About 10 miles away, it's a similar scene, but the message is very different.
We would strongly encourage you to vote no on ballot initiative 427.
The Nebraska chapter of the conservative political group Americans for Prosperity, or AFP, has gathered about 24 volunteers to encourage voters to reject the ballot measure.
And they're not telling the public what the whole cost of it is and all.
Nebraska is one of 3 red states, along with Idaho and Utah, where ballot measures are attempting to do what Republican leaders have not: expand Medicaid under the ACA. In Nebraska, Initiative 427 expands Medicaid to cover adults who make less than 138% of the federal poverty line, about $17,000 for a single person, and about $35,000 for a family of 4. Under the health care law, the federal government would cover 90% of the cost, but Nebraska would have to pay for the remaining 10%, estimated to be about $125 million in the first 3 years.
When you really truly start to look at the numbers, you realize that there's no way we can afford it.
Jessica Shelburne is the state director for AFP Nebraska.
Medicaid was intended for the most vulnerable in our society. So the elderly, disabled, low-income children, low-income pregnant women. By expanding Medicaid, we are risking the resources that we have available for those individuals because we're going to have to cover potentially 90,000 or more able-bodied working adults.
Shelburne represented the Vote No position in a debate this week organized by a business group in the state's capital, Lincoln.
This is something that, as it grows and we see more individuals enrolling on Medicaid expansion, the state just can't afford.
Her opponent was State Senator Adam Morfeld, a Democrat who represents part of Lincoln.
So I think the better question is how can we afford not to do this?
Morfeld has introduced 2 bills to expand Medicaid. In fact, there have been 6 attempts to expand the program in 6 years. All of them failed to pass the legislature or get the support of Nebraska's Republican governors.
I think that when it comes to affordable health care, our constituents and Nebraskans will be eminently more reasonable than our elected officials.
Morfeld says expanding Medicaid would not require new taxes. As evidence, he points to a new study by University of Nebraska researchers funded by the State Hospital Association. It found Medicaid expansion would create nearly 11,000 jobs and generate enough state and local tax revenue to pay for itself. Critics dispute that would be the case. And either way, if Nebraska voters approve Initiative 427, the legislature will still need to appropriate money for the state's share of the costs.
It brings in $1.3 billion in taxpayer funds over the course of 3 years that Nebraskans are already paying into the federal government, but that's going to other states.
Like many debates around the ACA, the initiative to expand Medicaid stirs up strong feelings.
You're taking it away from the most needy people to give it to people that need to get a damn job and work.
Members of the public testified about the ballot measure at a state hearing this week in Lincoln.
I'm a good example of what not having access to health care can lead to.
Amanda Gershon didn't have health insurance for most of her adult life, including when a chronic immune disorder flared up in 2013.
I had been a general manager of a restaurant, putting in a lot of hours, and started getting incredibly sick.
Gershon says she paid cash to see her doctor when she could and went to free clinics, but getting treatment for her chronic illness without insurance was difficult.
Between 2013 and up to the beginning of 2016, I just got sicker and sicker, and honestly, no one thought I was going to make it at that point. I did apply for disability and was blessed to get that, but that's the only way I could have gotten health care at that point.
When she became unable to work and receive federal disability benefits, Gershon qualified for Medicaid in Nebraska. She underwent surgery and got medication to manage her illness. But the 36-year-old says she wishes she could still be working.
I really believe if I could have gotten health care in 2014, I probably would have never ended up on disability.
Dr. Christine McVeigh is the Chief Medical Officer for One World Community Health Centers in Omaha. It sees more than 40,000 patients a year. About half of them are uninsured. McVeigh says clinics like hers have fewer resources than those in the 33 states and Washington, D.C., where Medicaid has expanded, including neighboring Iowa.
I feel like Nebraska is really falling behind. Looking at Iowa, just across the river from us, they have the ability to provide services to patients who fall into this gap in a much better way than we do.
Advocates for Initiative 427 also say expanding Medicaid will mean more federal and state dollars to support healthcare providers in Nebraska, including hospitals and community clinics like One World.
At best, it is a Band-Aid to fix the problem. Medicaid was not designed to be a program that would help shore up our hospitals, whether it be in rural or urban areas.
The great thing about laws is they change to address changing circumstances. And currently there are Nebraskans that are suffering and in many cases dying because they lack affordable health care.
If Nebraska voters approve Initiative 427, Medicaid could be fully implemented in the state by the beginning of 2020.